Hi everyone. Let us discuss about dental products. Okay, so you might be knowing that these dental products, these are the agents which are being used for dental hygiene as well as for various rearranging or various formation of various dental products. Okay, so here, if we go towards what we are going to discuss today in our session, like we would be getting about what are the dental products, and in that, to be specific, we would be discussing about few of the dentifrices, and then we'll be discussing about role of fluorides, few desensitizing agents. In that, we will be discussing about calcium chloride, calcium carbonate, sodium fluoride, zinc eugenol cement, as well as zinc chloride and zinc oxide eugenol cement to be specific. So coming to the introduction part, what is dental products? So I think if we take ourselves, like food is one of the most important day-to-day life activity, and which is the most necessary thing, and the thing which is responsible, or the part which is responsible for intake of food, is our mouth. Okay, and for our mouth also, the thing which are responsible for grinding it, crushing it, making it soft, and so that we can easily swallow it, it is our teeth. Okay, so here, as the food, because without food we can't survive. Okay, so for that reason, teeth are one of the most important part of our body. But the various body parts are important, but as it is responsible for intake of food, so the dental hygiene is very, very necessary, because teeth are one of the most important part of our body. Because if they are not healthy, they are not good, and if they are not having if they are getting various caries or bacterial infections and all, what happens? Our food intake will get affected. The pain, toothache, and all, it will get affected. So here, dental hygiene is one of the most important part of our day-to-day life activity. And there are many products which are present for the dental hygiene. And dental products, these are the substances which are being used for the effect on the teeth or for treatment of dental cavities. Those are things are called as dental products. So what are the various dental problems which we are going to come across in our day-to-day life activities? Like these are few examples which have been mentioned here. Dental caries, one of the most important, one of the most common problem which occurs to most of the people who eat sweets, chocolates, more, they would be having these caries. And plaque, that would happen, that is a little extreme part. Gingivitis, like inflammation of the gums, that could be occurring, and lesions that would happen in our mouth, sore throat, as well as in that mouth part, they would be having this uh, lesions that would be occurring. So here, this problem, I might be, I think everyone at least at once, you might have come across this toothache, which is unbearable. You can't bear that. It could be happening either due to caries or due to lesions or plaque. That could be varied, but the pain which we occur, that would be unbearable, and we need to get it treated. So here, this tooth, like apart from this toothache, another important thing that would happen is discoloration. Okay, it would happen due to excess of fluoride. That could be occurring from the like impure water or from the municipality water, that could be happening. And in certain areas, certain village people, they would be having like tooths will be like, even though they might be having brushing and all, still their tooth would be discolored. They would be having yellowish color. That happens due to the excess of fluoride content in the water. So here, the stained teeth. So usually, what happens if you go towards most of the people, they would be either using coloring agents, or they might be using for discoloration of that stained teeth and all. So coming to the list of the problems that could happen in our teeth, that are tooth decay, one of the most commonly occurring, gum diseases, oral cancer. Usually, it doesn't happen to normal people. It happens to those who eat like tobacco and all. That could be happening to those people, but normally it doesn't occur. This oral cancer to everyone, but those who are not taking proper care of their teeth, as well as those who are taking this tobacco and all, that could be leading to that. Mouth sores, this is also quite common. Tooth erosion Tooth sensitivity. Okay, so tooth sensitivity is also a very common problem nowadays, because here what happens in this sensitivity, enamel, that is our protective layer, which is there in the teeth, that get washed out. Okay, so that could happen due to over cleansing, or if we are eating a lot of junk food, if you're eating like a lot of outside foods, which includes acidic things. So that could be clearing our enamel, and that could like it would be just simply digesting our enamel, and which would exposing our various nerves, which causes this sensitivity. So it has shown us like various parts, like tooth erosion, tooth decay, you can see here, and gum disease, where you will be having lesions, or mouth sores. That is also quite common. Most of the people might be happening that. Oral cancer, it happens due to that tobacco, keeping of tobacco in the mouth for a longer period of time. That could be causing this oral cancer. Toothache, and this toothache can lead into, even we would be having that pain that could be going towards the ears also. So it could happen due to either dental damage or due to sensitivity. Okay. So sometimes for cosmetic needs, we would be just cleaning our teeth, and we would be making it a little brighter, so that we could have a much good appearance, good smile, and all. So that usually done by the actors and models and all that cosmetic cleansing of the teeth. But usually just simply by having maintaining a proper tooth care, that could lead into having a very good teeth. So here, how it happens, how this caries occurs. So first, this is altitude. So this tooth decay starts, and this tooth decay, it deep inside, and here you can see the nerves that could occur, and it causes the pain. When the toothache like caries are at the top part, they won't be causing a lot of pain. Not much pain will appear, but when they touches the nerves, then we will be getting that painful sensation. And at that time, either we need to have a certain treatment, or we need to have remove that teeth, or we need to go towards taking certain medications for that. So here, how this caries, dental caries occur. So usually what happens means dental caries occur, uh, maybe like a misunderstanding might happen, like it occurs due to that bacteria. And actually, bacteria is not the one which is responsible for decay of the tooth. Bacteria is like a third person. What it is doing is it is releasing an acid to digest the food. If you're not keeping any food inside your mouth, if you're cleaning your teeth properly, regularly, whenever you're eating, what happened? There won't be anything stuck in your teeth. Usually, to eat that stuck material, either chocolate or any sort of meat or whatever the thing that has got stuck in your teeth, to eat that, bacteria releases acid. That acid, usually the acid is lactic acid, which they releases for digesting that food material for their digestion, for their nutrition. So here what happened, to take that food material, they would be releasing this lactic acid. This lactic acid, what it does, it would excess of release of lactic acid decays the tooth, and due to which caries occur. Bacteria is that is black, what is there? It is not the bacteria. Bacteria is releasing acid, due to which our teeth is getting decayed. Bacteria is actually eating the stuck food which is there in our teeth. So simply, if you are making a habit of cleaning your teeth regularly whenever you are eating, or like 2 times usually doctors prescribe to clean the brush the teeth. So if we do it daily, like after as soon as we woke up, and when we go to sleep, before that sleep, if you are making a habit of cleaning your teeth, automatically the food won't start, and indirectly what happened, you won't be getting your tooth get decay. So dental caries, also known as tooth decay, it is happened due to the biofilm dependent disease. So what happened is the bacteria is responsible for that, which causes demineralization due to the release of that acid. So bacteria, it happens like it will be forming the fermentation of the food debris. It would be releasing that acid, due to which what happened, the tooth surface get decayed. So you can see here how that caries happen due to that release of that lactic acid by the bacteria. So if demineralization exceeds saliva and other remineralization factors, So then what happened? It formed up progressively down and it could produce dental cavities. Usually our body itself, our mouth itself have remineralization factors, calcium fluorinated toothpaste which we take that could help in remineralization. But what happened if you are eating a lot of junk food and you're not taking a proper care of your teeth, then what happened? This demineralization dominates and it would be causing the dental caries. So here, depending upon of tooth extra destruction, how much tooth has been destructed, various treatment can be used to restore the teeth. Usually, what happen if it is going beyond, like a lot of teeth has, most of the teeth has been got damaged. So you need to simply remove that, and you need to do root canal. You need to take substitute teeth. You need to take. But if it is very minor stage, then by maintaining a regular hygiene of your teeth, you can avoid the dental caries. So usually, if you're having that dental caries now itself, it is not totally cannot be treated now if it is at higher extent. But what you can do is you can take care of the remaining teeth what you're having that can be get prevented from the dental caries. Or if it has been habituated to the kids at the younger ages, if you're making them habit of maintaining a proper teeth care, then they can be that they cannot be have the dental caries for their lifetime and they could have healthy teeth overall their life. So what are the risk factors? So shared by the adults and children include high bacterial count. Sometimes what happen if you're having a family history, then your teeth might be getting it. So you might be also getting that cavities. But usually, if you're having a lot of sugary foods, drinks, and if you're taking junk food a lot, that could cause this. An inadequate fluoride content. Look here, like fluoride, excess of fluoride causes discolorization, stain teeth, but a minimum amount of fluoride is responsible for having a good teeth. So that is when we need to have a little amount of fluoride content is also required, and low saliva, dry mouth, which means that you should drink plenty of water regularly. Drinking of water is very important, or else what happens? The saliva content will be less, and the caries, minor caries, can also be could lead into a heavier tooth decay. And so low socioeconomic status like indicate poor diet, lack of access to care, and usually aging, disease treatment can contribute to decay. But usually, if you are maintaining a less sugary diet and not eating junk food a lot, then indirectly you are maintaining a good hygiene for your teeth. Prevention, maintaining dental hygiene with the help of dentifrices. Like these are being used to remove the dental plaque and stains, and flossing and brushing regularly. Administration of fluorides like caries agents, sodium fluoride, stannous fluoride. Okay, but those people who are having the stained teeth, for them we would be having special toothpaste, fluoride-free toothpaste that is there for those people who are having excess of fluoride intake. For them that will be there. But usually sodium fluoride and all, these are good for treatment of dental caries. Now coming to dental products, you can just see these are the list of products where mouthwashes, Listerine, Colgate powders are there. We are having this brightening products like Orbit and all, and brushes are the paste. These are certain agents. So types of dental products with the short form of CAD, and you can have like CAD for cements and fillers, anti-caries agent, dentifrices, desensitizing agents, mouthwashes. So just simply CAD and you can remember, you can list out the various dental products that would be there. Coming to first dentifrices or cleansing agents. Usually our paste and all, the most commonly product or agent which is present in this cleansing agents and all is sodium fluoride. Okay, usually we'll have powders and paste that will be having calcium carbonate, calcium phosphate, calcium sulfate. Okay, so these are the dentifrices applied as powders or paste. So they are used for cleansing of teeth. Okay, so they would be cleaning our teeth or dental abrasives also we can call it as. So removing the plaque or debris. So they also contains like to have a little bit We are applying sweetening agents will also be there in that, but mostly they are used for the cleansing of our teeth. So one of the important commonly used dental abrasive, also we can call it as, is calcium carbonate. It is also called as calcium card. It is white odorless light powder, usually soluble in carbon dioxide and water. So here, how it can be prepared is important. How it can be prepared simply by taking sodium carbonate and treating with the calcium chloride. You will be getting calcium carbonate. Another is by simply passing carbon dioxide through lime water. This is a very simple method with carbon dioxide. When treated with lime water, you will be getting calcium carbonate. So here, this calcium carbonate, how it is being assessed, because when we go towards various dental products which are there in the syllabus, in that you need to have like about study about them dental products, and essays of them are quite important. Okay, so how they are being assayed, what is the principle involved in them, that is quite important for all the dental products. So here, if you can go towards this calcium carbonate, in this, the principle involved is complex symmetric titration. Okay, it has been assayed by complex symmetric titration method. So how you're going to perform the assay? You need to boil for 10 minutes a solution calcium carbonate, cool, and dilute with 50 ml of water, and titrate with 0.05 normal or molar disodium EDTA with few ml of expected endpoint. Then again, you need to add 8 ml of sodium hydroxide solution. After addition of this 8 ml of sodium hydroxide solution, we would be adding our indicator. Indicator is Calgon mixture. Calgon mixture is used as indicator for assaying calcium carbonate. It is quite important for the objective part also. So Calgon mixture used for the indicator for calcium carbonate assay. And then continue the titration where the change on the color will be from pink to full blue. Initially, you'll be getting pink color, then it will changes to blue color. That is your endpoint. Coming to anti-caries. So just now what we have seen is anti-abrasive agents, cleansing, which are used for cleaning of the teeth and all, calcium carbonate. Now anti-caries, once you got that caries, like you've got an infected teeth, so how you can treat that? So here, these in agents what they help in prevention of dental decay. Like you got a caries, we can't regain a new teeth. Little bit of we can be regaining, but still you can prevent it from fully getting decayed by using sodium fluoride, stannous fluoride, or sodium monofluoride. Actually, this happens due to lactic acid. This is also quite important objective part. Like what is the agent responsible for the dental caries? It happens due to bacteria releasing lactic acid, which will be decaying the teeth. So that is our lactic acid, the acid which is released by the bacterial metabolism for the digestion of the food which is stuck in your teeth. Okay, stuck in your teeth. For digestion, that it will release lactic acid. So it can be prevented, this dental decay, by using sodium fluoride or stannous fluoride or sodium fluorophosphate. So lower fluoride, actually fluoride is helping preventing dental caries. Fluoride forms extra layer on the teeth, prevent tooth decay. We get fluoride usually from the water, what we're getting from the municipality. It will be containing the fluoride content. So here, if it is huge fluoride is there, sometimes the water, what we're obtaining, like based on the sources from where it is obtaining, might be having excess of fluoride that could cause fluorosis. Okay, so then you diving stain teeth. Fluoride itself is an fluoride is an anti-carcinogenic as it replaces hydroxy ion or hydroxyapatite. So with fluoride, you want to form the outer surface of the enamel. So it is responsible for creating a protective enamel on over the teeth. So that will help in getting a good hygiene on our teeth. So here it can be administered by two routes. Either we can take it orally or even we can apply topically for the tooth. So here, how much fluoride content is responsible or for having a good hygiene? Okay, so here we require 1 to 2 parts per million. That's enough. Okay, if 1 to 2 parts per million, if it is present in the drinking water, then it could be helping to having a good hygiene in the teeth. But fluoride can also be administered orally if you're having dental caries and all. In order to prevent our tooth from getting more decay, we can add like substitutes or supplements or the paste or the powders having this fluoride. So like a 2% aqueous solution of sodium chloride or 8% solution of stannous fluoride used for the topical application. Two such established fluoride sources are sodium fluoride and stannous fluoride. So let us see about one of the agent, that is sodium fluoride. It is a white powder, colorless crystals. It is soluble in water or insoluble in alcohol. So here, how it can be prepared. So hydrofluoric acid, the chemical properties, usually how it has been responsible to give the fluoride is when it has been coming across HCl and it gives hydrogen fluoride and NaCl. How it is being prepared? It's simply prepared by treating this hydrofluoric acid by neutralization of sodium carbonate. Neutralizing hydrofluoric acid with sodium carbonate gives us sodium fluoride, and this sodium fluoride is used as anti-caries agent. So how the assay of sodium fluoride can be performed? So assay of sodium fluoride is being performed by non-aqueous titration. What are this non-aqueous titration? In analysis, might be have come across. Non-aqueous titrations are those titrations which doesn't uses water as a solvent. Okay, we won't use water in that. We would be using other solvents other than water. It is non-aqueous. So here we are using 5 mol of acetic anhydride, 20 ml glacial acetic acid, and added to 80 mg of sodium chloride. You need to heat the mixture, dissolve, allow it to cool. Then we would be adding 20 ml of dioxane. And here we are using crystal violet as our indicator. And we need to titrate with 0.1 normal per chloric acid to get the green endpoint. Okay, so that is the method for the assay where we are using acetic anhydride glacial acetic acid as our solvent, and we don't need to use any amount of water. If water is being used, we won't be getting a proper results. So that is why we are using a non-aqueous titration method for the assaying of sodium fluoride. Our indicator is crystal violet, and it is being assayed by 0.1 normal per chloric acid. Coming to next agent which is being used, this is alum. That is a double salt. So here, usually this alum is being used when you're having when you're getting the gums, bleeding gums and all. For treatment of that bleeding gums and all, alum is being used because it is having that astringent property which is used to tighten the skin or tissue, and it is having that hemostatic agent property which will be preventing the bleeding. So for that reason, alum is also being used for our dental uh, hygiene, and it's also have a little bit antiseptic property also, which aid in the prevention of the tooth decay. So alum, actually, if you go towards the chemical properties of alum, it is a category, comes to the category of double salt. What are these double salts? When the chemical, when it is having two ions, two cations, two metals, when they are being present in it for forming the salt, we call them as double salt. So we can have alum of two types. Usually, commonly occurring alum is potash alum, that is potassium aluminium sulfate. Another alum that could be found is ammonium aluminium sulfate. So here it is a crystalline chemical having been used for various healing properties, and it would be used as various like even for bleeding of the face during in the shaving after shave type, for that also it is being used. But for tooth prevention also, because of its astringent property, we would be using this alum. Coming to phosphates, like inorganic phosphate salts are also useful for the prevention of dental caries. Phosphate ions needed for the stronger bones. So that is why we need to add phosphate will also be there in our toothpaste and all for maintaining the dental hygiene and for the cleaning of our teeth. Coming to desensitizer, you might be knowing about Sensodyne advertised, in which they might be showing someone is eating some fruit or something, and they are getting like they are eating like ice cream, or if you are eating drinking a tea, some hot or cold, both the things, because your teeth have become sensitive, so they can become sensitive for hot as well as cold. So those people who are having this sensitivity, that happens when the caries has got deepened to the nerves. When they reaches the nerves, then the people will be having this sensitivity where they can't even have hot, or they can't even have the cold things. So for that, they will be using Sensodyne. What it contains actually, we'll see what is the thing responsible for that. So desensitizing agents are used in tooth decay and precipitation of heat and cold. It is used to reduce the sensitivity of heat and cold and act as local anesthetic, because it would be just decreasing the sensitivity, decreasing that tooth sensitivity there, making it little bit mild. So here it acts as a local anesthetic. So here, usually, soluble potassium ions, they are responsible for decreasing this sensitivity. They penetrate the dental tubules, reach the nerve fibers, with because this depolarizing and desensitizing effect. So when you go towards this Sensodyne or these sensitivity toothpaste, they will be having potassium nitrate, because potassium ions are responsible for this depolarizing and desensitizing effect of the nerves. So it would be consisting of potassium ion, which works desensitize the nerves and provide the relief of the sensitive tooth pain. So if you go towards the Sensodyne toothpaste, it would be having this major content of potassium nitrate in it. Along with that, it would be having various cleansing agents. But usually, if you're cleaning or using applying this potassium nitrate to that sensitive teeth, it would be relieving that pain, what is being causing due to that nerve and sensitivity. Okay. So the main agent which would be there for this Sensodyne and this desensitizing agent is potassium nitrate, because potassium ions are responsible for this desensitizing effect. Coming to mouthwashes, where these mouthwashes, they are being used for various purposes. All the things like for cleansing, for the dental caries prevention, and for removal of stuck food and all. Because when you are gargling or when you are cleansing with mouthwashes, they would be just rinsing your whole mouth and cleaning all the material which is there in that, and decreasing the pH also, making it much more better for our maintaining a good pH for our healthy teeth. Okay, so mouthwashes, they could be of various forms. Dental products contain several, like you will be having zinc chloride, mouthwash, zinc sulfate. It has mild antiseptic effect, desensitizing effect, zinc chloride, sodium bicarbonate having antiseptic acid property, sodium chloride for irrigation like water and all. So you can have a mouthwash having all these ingredients in it. So we are taking one of the ingredient, that is zinc chloride. Zinc chloride, it is if you take or itself, it is a deliquescent, very soluble in water, crystalline, odorless powder. It would be reacting with water to form zinc hydroxide chloride, because it forms a deliquescent, absorbs moisture easily. So that is why we need to keep it away from the moisture. Whenever you come across a deliquescent or such like compounds which absorbs moisture, we need to protect it from the air. We need to keep it in airtight containers. So here, how we can prepare zinc chloride, simply by treating with hydrochloric acid and heating it in zinc chloride, we will be obtaining the zinc. When you treat it with HCl, we get zinc chloride. How it has been assayed? It will be assayed by complexometric titration. Indicator used is heliochrome black tea. Okay, so indicators, the principles are quite important whenever you come across the SFR. And aqueous solution of compound, add ammonium chloride as a buffer indicator, and it is being titrated with standard 0.05 normal sodium EDTA, disodium EDTA. Similar, we have seen earlier, similar way, but here the indicator used is heliochrome black tea. It is used as astringent, mild antiseptic, and desensitizing agent especially for in the dental products. And it has to be kept in airtight containers because it absorbs moisture. Coming cements and fillers, like you might be have if someone has gone through the treatment for the teeth, you might be giving like they initially they'll be going for the root canal, in which they would be just digging up the teeth, cleaning all that bacterial infected part, and then they would be deeping it and making a way of it. Then they would be filling up cement and fillers. So one of the important cement and fillers like dental cements used temporarily to cover the protected area. And when they are filling up that area, what happened? It helps you to, again, like if the teeth is totally removed, what happened? It will create a gap there and it would be difficult for you to chew or eat something. So for that, they would be having this filling of the cements or in that, and then they would be giving coating, or they might be giving some sort of clips which might be used for gold and silver, usually used. You know what is the reason why gold and silver have been used? Because this gold and silver, they belong to noble metals category. Noble metals, platinum, gold, silver. These are noble metals, which means that why they have been regarded as noble metals? Because they won't react any other elements. They won't react easily and they would be staying in the pure form as it is. So that is why if you're having this gold and silver clips for your coating caps of with that, then it would be won't be causing any sort of infection and all. If you take other metals apart from these noble metals, that could be causing a lot of infection because they would be reacting either with water or with the food and all. But these gold, noble metals, gold, silver, platinum, they won't react. So that is why this dental people, they would be using these as the caps for the tooths, gold and silver, because not because they might be a gold that is costly and it looks good and it's like jewelry type. No, it's not for that. It is the reason behind is that it doesn't react. It is a noble metal and it won't react with any other elements. So that is why they would be keeping this coating with the gold. So one of the important cement that commonly used is zinc oxide eugenol cement, which will be consisting major element in that would be zinc oxide. The percentage would of 69% of that, white rosin, zinc stearate, zinc acetate, eugenol. If you go towards formulation, how it has been prepared. It is a material, zinc oxide eugenol cement, created by combination of zinc oxide eugenol oil of globes, and then acid-base reaction takes place, which forms zinc eugenol chiliate. And this is been reaction is being catalyzed with water, and then it has this zinc eugenol cement will be having an aesthetic as well as antibacterial properties. So if you go towards exact formulation of the zinc oxide, in that we will be taking 69%. This have a principal ingredient with white rosin, which will be taking up about 29.3 percentage, which reduce the brittleness set of cement. Zinc acetate, 1%, accelerate and improve the strength. Zinc stearate, again, would be taking 0.7. Acetate, we take 1%. Stearate will take 0.7, which act as plasticizer or accelerator. Then eugenol, 85% eugenol is nothing but a eugenol content. It would be having this solvent that we are taking, two solvents we are taking, eugenol as well as olive oil. So all eugenol 85% reacts with zinc oxide and act as anesthetic, and olive oil 15%. So plasticize. So if you go towards assaying method, as zinc oxide is also assayed. We have seen a complex symmetric titration method earlier, similar way, but here the indicator is different. Here we are using xylitol orange, and we need to maintain the pH 5.3. It is titrated with against disodium EDTA 0.5 molar. But here xylitol orange is used as the indicator for this assaying of zinc oxide. Okay, so that's about these various agents. And one thing I need to include, you might be knowing about this. Most of you might have know about that, but still I'm telling. So here, our tooth decay, even like we have seen about various agents due to bacteria and all, but simply when you are having high acid content taken regularly in our mouth, that could also causes the tooth decay. If the pH of mouth is less than 5.5, okay, if it is less than 5.5, it would cause the tooth decay. It will trigger the tooth decay. So what we need to do, we need to maintain. Usually what happens is if you take all this toothpaste or these mouthwashes and all, they are quite basic nature. They will be having base in them. So these bases, they will reduce the pH of our mouth. How our mouth pH decreases to 5.5? Reason is when you are taking the food which are having high acid content. So if you're taking such foods which are having high acid content, then our acid tooth decay get initiated, and it could be triggering the decay of the teeth and all, and that is the one responsible for our tooth decay. So whenever you come across eating a lot of things which are having acid in it, like usually the things which are sour, which are having like uh, quite sour taste in them, they would be having this acids that like pickle, and if you go towards a lot of all this junk foods, burgers, and all those things, they would be having a lot of acid content in them. So whenever you're eating such things, you should be having a habit of cleaning your teeth, applying a toothpaste and all. What it does is it will decrease the pH. And that moment itself, if you are applying it, what happens? You're protecting it from the further damage. So these things, if you are maintaining, if you are keeping in our mind, and regularly, if you are doing it, then what happened? Indirectly, you are making your teeth span will get increased. Nowadays, dental caries have been becoming quite common, especially in the kids and teenagers a lot, because they are having a certain routine of junk food as well as sweet chocolates and all. All these things indirectly lead into this dental infections and dental caries, and ultimately you need to remove the teeth, and then you need to again go for this various costly treatments and all. So you can simply avoid all these things by having a good dental hygiene. So in today's session, we have discussed about what is the dental caries, what are the various dental crises, what are various desensitizing agents, as well as cements and fillers. In that, we have seen about zinc oxide using on cement. Okay, so in this, you come across the important concept here is what are they like when you go towards their essay, like when you go towards dental products, in that you would be having a list of compounds. Like today we have seen about sodium fluoride, calcium carbonate, we have seen about zinc chloride. Okay, so all these agents which are there, you need to have an idea, or you need to prepare about their preparation, their essay. And in essays, usually today, if we compare, we have seen four products. In that, most of them, they were having complex metric titration. So complex metric titration method will be common for all, but what the difference you have observed is the indicators are being used different. Different indicators were there for each compound. So that differences you keep in mind. Procedure for complex metric titration doesn't change much, but indicators vary sometimes based on the product. So that differences keep in mind, like zinc oxide is being for that xylene or orange is being used as indicator. And if you go towards other one which are having this like iriochrome black tea, if you go towards zinc chloride, okay, and likewise we have seen about calcium carbonate, in that we have seen in this sodium fluoride, it has been assayed by non-aqueous titration, and the crystal violet is being used as indicator. And if you go towards calcium carbonate, and that also we are having a heliochrome in that, we are using sodium hydroxide. In that, again, we are using calcium mixture. So this is also quite important points. Like they would be asking, what is the indicator used for the calcium carbonate assay, the assay of calcium carbonate? What is the indicator we use? So you might have to focus. First, you focus on the differences. What is the difference? Other than that, something that it is complex. Principle complex symmetric titration means when you come across complex symmetric titration, all of the complex symmetric titration, not only the dental products, whenever you're going to come across complex symmetric titration, they would be having titrated with standard 0.05 molar disodium EDT. It doesn't vary, it doesn't change, but little bit difference might occur based on the product. So if you keep in mind what is the difference, then it would become quite easy for you to buy up. Because what happens when you come across this inorganic compounds, there are lots of compounds. It's just the dental products, we got five, six compounds. But apart from that, you have many of the compounds which are there in that. In that, you might be coming across various principles, complex symmetric method, precipitation method, you might be coming across non-aqueous titration method, acid-base principle method. So when the principle is coming up, focus on the principle, what is it involved. Go towards that matter. Matter might not that different, but if there is difference in indicator, note it down. Like calcium carbonate, calcium mixture, zinc oxide, xylitol orange. Likewise, for zinc chloride, hydrochrome black tea. So like that, you keep in mind what happened. You will be getting the full marks and you won't be losing the marks in the essays because the procedure might not differ much, but indicators sometimes they varies. Okay, so these are certain things. And apart from this, this dental products, not only it is a thing that is there for your syllabus, but these are quite very helpful for your day-to-day life activity. Okay, like it is like when you keep this knowledge within yourself, and if you try to implement for yourself, it would be helping you out for having a good dental hygiene. And dental hygiene, if you're maintaining well, then automatically you are saving yourself with a lot of expenses that would happen due to various dental treatments. So this there are certain things that are common and that has to be implemented for your day-to-day life. And just by knowing them is not simply enough. Just by knowing the knowledge about what is there, by adding them, it's not that you should apply that for your life. Then only it would be like, this is something useful for me, and I have learned about this. And if I apply that into my day-to-day life activity, it would be safe for yourself itself. Like you can save a lot of money, you can have a good dental hygiene, you can even tell to your like friends and families that if you just have this habit, it could be very helpful for you. So this sort of products and all these agents, such sort of topics are very important and they are very useful for us. Any doubts in this, anyone? Okay, so these are the various dental products what we have come across. Okay, so it's there in your syllabus like sodium fluoride and desensitizing agents like potassium nitrate is one of the desensitizing agent that would commonly seen in the sensitivity uh, toothpaste and mouthwashes. They are quite very useful because they have multiple applications because they can not even clean, they can even help in preventing the dental caries and desensiting action is also there in various mouth products. Okay, and if you go towards a few compounds that includes zinc chloride, and if you go towards cements and fillers, we have lost across eugenol cement. Okay, and then we have zinc oxide eugenol cement that can be prepared using a mixture of zinc oxide with various white rosin, zinc acetate, and eugenol and olive oil. So these are the various dental products. Okay, so that's it for today. Shall we stop the session here? Okay. Okay, fine. Thank you all.